Thank you, and thank you for the opportunity to present today. 1 in 10 Australians aged over 65 have dementia, and 3 in 10 aged over 85. It is estimated that more than 1.2 million Australians are involved in the care of a person with dementia. Most people with dementia will have changes in their behaviour at one time or another, and these can be very distressing for the person themselves, as well as for their families and carers. Many of these behaviours can be helped with the use of non-pharmacological strategies, combined with the support of families, carers and the healthcare team. So today I'll be talking about a Veterans Mates intervention that encouraged the use of a simple strategy for personalising care for patients with dementia, and how this was successful in encouraging the use of non-pharmacological strategies, as well as how it has potentially reduced the use of antipsychotic medicines. Okay, so first I'd like to give you an overview of the Veterans Mates program. So the Veterans Mates program is a collaboration between the Department of Veterans Affairs and the University of South Australia, which provides tailored information on a quarterly basis for veterans and their health professionals with the aim of improving medicine use. Administrative claims data are used to provide direct patient-based feedback to GPs, along with supporting educational materials. Targeted veterans are provided with an educational brochure which encourages them to talk to their doctor. The program is evaluated using surveys provided at the time materials are distributed, as well as using observational studies. And since 2004, the program has covered more than 40 topics, and it's involved more than 300,000 veterans, 35,000 of their doctors and 8,500 pharmacists. We've received a high degree of satisfaction with the program. Over 3/4 of veterans who have given feedback have reported that the education is helpful, and over 80% of the health professionals. So to give some background about why we did our intervention, antipsychotic medicines have been associated with a number of serious adverse events, including increased risk of hip fracture and increased risk of death in the elderly. Despite their limited benefits and potential for harm, behaviours of concern are often treated with antipsychotic medicines. And we've seen that around 1/4 of residents in Australian aged care facilities are dispensed a regular antipsychotic, and we have seen similar rates in the veteran population. Risperidone was indicated more generally for the treatment of behavioural disturbances in dementia, but in August 2015, the Australian Therapeutics Goods Administration limited its use to treatment of up to 12 weeks of moderate to severe dementia only of the Alzheimer's type. And there are 2 choosing wisely recommendations that are focusing on this issue. So our topic focused on highlighting the TGA changes, as well as highlighting the importance of personalising care and using non-pharmacological strategies as first-line treatment for behaviours of concern. The Top 5 program was one of the strategies that we highlighted in our materials. This strategy was developed by the New South Wales Central Coast Local Health District, and it's a simple process which encourages the health professional to talk to carers and families to obtain non-clinical information which might help personalise care. It asks carers to write down up to 5 tips and to share these tips with the healthcare team and others who care for the person with dementia. The Clinical Excellence Commission implemented the program in 21 New South Wales hospitals and found positive results. Clinicians had increased confidence in caring for patients with dementia. Carers and clinicians reported less agitation in patients, and there was also some evidence of a reduction in the use of antipsychotic medicines. Our intervention involved sending information to GPs about their veteran patients who were aged 65 years or older and likely to have dementia as identified by their medicines or a hospital diagnosis. We identified to GPs where a patient with dementia had been dispensed an antipsychotic medicine and asked them to review the use of the medicine, as well as review the use of non-pharmacological strategies. GPs, residential aged care facilities and pharmacists were provided with supporting educational information about how to manage behaviours of concern and also about the limited role of antipsychotic medicines. We did not distribute materials to targeted veterans, however we encouraged all three of the health professional groups to share a carer's brochure with families and carers of their patients and residents with dementia and to ask them to share their practical tips. The health professionals were provided with a one-page response form to evaluate whether sharing practical tips improves care. So this slide here shows the insert which was part of the educational materials developed to support families and carers. This insert was adapted from the Top 5 program, so it encourages carers and families to write down their practical tips, what sort of things they could share, and also gave examples of practical tips and how they were helpful in that situation. It also highlighted who might benefit from receiving a copy of these tips, and all of these materials are available on the Veterans Mates website. So over to our results. We distributed the materials to over 5,000 GPs, 2,500 residential aged care facilities, and over 8,000 pharmacists in August 2016. And we received responses to our survey from 7% of the GPs, 8% of aged care facilities, and 4% of pharmacists. So first of all, we asked all three health professional groups how likely they were to assist family members and carers of their patients or residents with dementia to identify tips for providing reassuring and familiar care. Almost 90% of GPs and over 95% of pharmacists and aged care facilities indicated that they were either very likely or moderately likely to do this. We then asked the aged care facilities whether their staff members were likely to use any of the practical tips or implement these tips as part of a resident's care plan. More than 3/4 indicated that their staff members were likely to implement the tips. We asked the GPs where the carer had shared their practical tips, such as a top 5, did they feel the patient became less agitated and distressed? Although the majority of GPs reported being unsure, over 30% responded yes, that they had felt their patients had become less agitated and distressed. And finally, we asked pharmacists and aged care facilities whether they had received any positive feedback from families and carers regarding how helpful they had found either identifying or sharing their practical tips. And both pharmacists and aged care facilities had received some positive feedback, with 27% of pharmacists and 42% of aged care facilities, and only 1% of either group had received feedback that was not positive. So this graph is showing the rate of veterans aged 65 years and over per month who have been dispensed risperidone for dementia compared with low-dose haloperidol. The first orange line indicates August 2015, when the TGA limited the use of risperidone, and the maroon line indicates when the Veterans Mates intervention was distributed. So you can see that the use of risperidone has remained stable up until the TGA change, where there has been a decrease in use. And although we don't have quite enough data yet, the initial data indicates that there has been a reduction following our intervention. So this is a similar graph, except it's looking at the rate of veterans dispensed risperidone for dementia, and it highlights the previous Veterans Mates topics and also NPS topics that have either focused on antipsychotic use or have included some information about limiting their use. And you can see that slowly over time, the direction of the curve has changed, which demonstrates how repeat messages over time can be beneficial. So in conclusion, this intervention demonstrated that encouraging family members and carers to identify their tips was well received by both carers and health professionals. The majority of health professionals indicated that they were likely to encourage the use of this simple and low-cost strategy, and where feedback was received, it indicates that providing these tips has helped. The subsequent decrease in the use of antipsychotic medicines following the intervention further supports the use of this strategy in helping to reassure and also reduce distress for those living with dementia.